An anal fissure is a tear or open sore, ulcer, that develops in the lining of the large intestine, near the anus. Anal fissure symptoms. The most common symptoms of anal fissures are 1. A sharp pain when you poo, often followed by a deep burning pain that may last several hours. 2. Bleeding when you poo. Most people notice a small amount of bright red blood either in their poo or on the toilet paper. Diagnosing anal fissures. The GP will ask you about your symptoms and the type of pain you have been experiencing. They may also ask about your toilet habits. They'll usually be able to see the fissure by gently parting your buttocks. A digital rectal examination, where a GP inserts a lubricated, gloved finger into your bottom to feel for abnormalities, is not usually used to diagnose anal fissures as it's likely to be painful. The GP may refer you for specialist assessment if they think something serious may be causing your fissure. This may include a more thorough examination of your bottom carried out using anesthetic to minimize pain. Occasionally, a measurement of anal sphincter pressure may be taken for fissures that have not responded to simple treatments. The anal sphincter is the ring of muscles that open and close the anus. What causes anal fissures? Anal fissures are most commonly caused by damage to the lining of the anus or anal canal, the last part of the large intestine. Most cases occur in people who have constipation, when a particularly hard or large poo tears the lining of the anal canal. Other possible causes of anal fissures include 1. Persistent diarrhea. 2. Inflammatory bowel disease, IBD, such as Crohn's disease and ulcerative colitis. 3. Pregnancy and childbirth. 4. Occasionally, a sexually transmitted infection, STI, such as syphilis or herpes, which can infect and damage the anal canal. 5. Having unusually tight anal sphincter muscles, which can increase the tension in your anal canal, making it more susceptible to tearing. In many cases, no clear cause can be identified. Treatment for anal fissure from a GP. A GP can prescribe medicine to help relieve your symptoms and speed up the healing process. This can include laxatives to help you poo more easily and pain-killing ointment that you put directly on your anus. Surgery may be recommended in persistent cases of anal fissure where self-help measures and medicine have not helped. Surgery is often very effective at treating anal fissures, but it does carry a small risk of complications, such as temporary or permanent loss of bowel control, bowel incontinence. Anal fissures usually heal within a few weeks without the need for treatment. But they can easily come back if they're caused by constipation that remains untreated. In some people, symptoms from anal fissures last 6 weeks or more. Chronic anal fissures. How to ease symptoms of anal fissure. Adopting some simple self-help measures can make going to the toilet easier. This will allow existing fissures to heal, as well as reduce your chances of developing new fissures in the future. Self-help measures for avoiding constipation include 1. Plenty of fiber in your diet, such as fruit and vegetables and wholemeal bread, pasta and rice. Adults should aim to eat at least 30 grams of fiber a day. 2. Staying well hydrated by drinking plenty of fluids. 3. Not ignoring the urge to poo. This can cause your poo to dry out and become harder to pass. 4. Exercising regularly. You should aim to do at least 150 minutes of physical activity every week. You can help soothe the pain by taking simple painkillers, such as paracetamol or ibuprofen, or by soaking your bottom in a warm bath several times a day, particularly after a bowel movement. Medicines. There are a number of different medicines a GP may recommend to help reduce your symptoms and allow your anal fissure to heal. Laxatives. Laxatives are a type of medicine that can help you poo more easily. Adults with an anal fissure will usually be prescribed bulk-forming laxative tablets or granules. These work by helping your poo retain fluid, making it softer and less likely to dry out. Painkillers. If you have prolonged burning pain after having a poo, the GP may recommend taking common painkillers, such as paracetamol or ibuprofen, which you can buy from a pharmacy or supermarket. Glycerol trinitrate. If your symptoms do not improve within a week or two, the GP may prescribe a medicine called glycerol trinitrate, GTN, an ointment applied to the anal canal, usually twice a day. GTN works by expanding blood vessels in and around the anus, increasing the blood supply to the fissure and helping it heal faster. It can also help reduce the pressure in the anal canal, which should ease the pain. Topical anesthetics. If you have particularly severe anal pain, the GP may prescribe a topical anesthetic to numb your anus before you have a poo. Calcium channel blockers. Calcium channel blockers, such as diltiazem, are a type of medicine usually used to treat high blood pressure, hypertension. Botulinum toxin injections. Botulinum toxin is a relatively new treatment for anal fissures. It's usually used if other medicines have not helped. Botulinum toxin is a powerful poison that's safe to use in small doses. Surgery. Surgery may be recommended if other treatments have not worked. It is generally considered to be the most effective treatment for anal fissures, with more than 9 out of 10 of people experiencing good long-term results. However, it does carry a small risk of complications. There are a number of different surgical techniques that can be used to treat anal fissures. Lateral sphincterotomy. A lateral sphincterotomy involves making a small cut in the ring of muscle surrounding the sphincter to help reduce the tension in your anal canal. This allows the anal fissure to heal and reduces your chance of developing any more fissures. It is a short and relatively straightforward operation that's usually carried out under a general anesthetic on a day-patient basis. This means you'll be asleep while the procedure is carried out, but you will not usually have to spend the night in hospital. A lateral sphincterotomy is one of the most effective treatments for anal fissures, with a good track record of success. Most people will fully heal within 2 to 4 weeks. Advancement anal flaps. Advancement anal flaps involve taking healthy tissue from another part of your body and using it to repair the fissure and improving the blood supply to the site of the fissure. If you know something extra about this, then comment below, because this will be helpful for us. At the end, it is requested to please subscribe our channel.